Canada's doctors are pushing for more young people to get vaccinated for a deadly disease. Meningitis B makes up close to 60% of meningitis cases. It is very rare, but it can be very dangerous, often fatal, and it's misdiagnosed as a common flu, and 90% of patients diagnosed will die if they don't get treatment. Dr. Shelley McNeil is the head of the Infectious Disease Division at Dalhousie University and the Nova Scotia Health Authority. She's joining us from Halifax this morning. Welcome.
Good morning.
First of all, what makes meningitis B so dangerous?
It's, as you said, it's a bacterial infection. One of the big challenges with it is it's very difficult to diagnose, and it progresses very, very quickly. So people can go from feeling sort of generally unwell, maybe a bit of a fever, then developing headache, to being critically ill over a matter of hours. So it's sort of strikes fear in everyone's heart, parents and doctors, because it is something that's very difficult to diagnose until it's very serious.
And there have been 2 fatal cases in students. How is it affecting people in Canada?
We have about 100 to 150 cases a year, so it's a rare infection. But because about 10% of people who develop this infection will actually die from it, and about another 3 out of 10 or so will develop complications like neurologic complications, sometimes serious things like requiring amputations and the like. It is an infection that, though rare, it's so serious when it happens. We really want to do everything we can to try to make people aware about it and also try to prevent it with a vaccine, as you mentioned.
It's a disease that spreads very quickly, especially when people are living in close quarters. So that makes you think of college students, teens, boarding school students. Why are young people so under-vaccinated against this infection if it has such serious outcomes?
Well, one of the big challenges with meningitis B vaccine is it's a new vaccine, and it's not part of the routine childhood immunization schedule or school-based vaccine program across Canada. So many people think that because they've had all of the vaccines that were recommended to them, all the baby vaccines they were supposed to get, all of the vaccines they were supposed to get in junior high, that they would have had this vaccine. But unfortunately, because it's so new and it's not yet part of the routine schedule, no one will have had it unless they've deliberately gone out and sought the vaccine on their own. So it's important for people to know that, because many times what's happened with us in the cases we've been involved with, and when people are unfortunately getting sick or dying from this infection, is they didn't even know there was a vaccine they could have accessed. So part of the reason we're talking about this today is that as people go back to university, we know that university students, particularly those who live in dormitories or college students, are about 3 times higher risk than the general population of getting this infection. So this is an opportunity, this is a really good opportunity to say, you know, meningitis B vaccine is out there. Now's the time to go and seek it out.
Dr. McNeil, anybody listening to this says, okay, this is something I want to go and do. What do they need to do?
So you can speak to any healthcare provider, depending on which province you're in. It may actually be funded for students going off to university or college. So Nova Scotia and Prince Edward Island, for example, have recently begun to pay for this vaccine for students in that situation. Others may not, but their health plan or their parents' health plan may pay for it. So speak to your doctor, your pharmacist, your public health department office, and ask about the vaccine. It's 2 doses of vaccine, so 1 now and say 1 when you're home for Thanksgiving, for example. You know, and you can purchase the vaccine if it's not covered by your insurance, but important to get at least that first dose in before you head off to university.
Dr. McNeil, thank you.
Thanks very much.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.